Welcome, friends. We are back with another Live with Dr. McDougall. And it's always nice to see all of you logging in. I'm Gustavo Tolosa, and I'm the webinar host. And today we have the one and only Dr. McDougall, and excited to hear what he has to say today. I think he's going to be talking about his newsletter and about Alzheimer's disease and taking questions. So here we go with an exciting webinar. And I want to welcome you, Dr. McDougall. How are things going in Santa Rosa? I think pretty crazy, busy.
Oh, life is really good. So
Okay.
I couldn't complain. And it seems like last Thursday we talked about this, and many Thursdays the grandkids are coming over for a swim this afternoon. And when you say the one and only Dr. McDougall, fortunately, just to brag a little bit, I have three children, and two of them are doctors. So one's a PhD in chemistry. The other happens to be on the faculty of Oregon Health and Science University, the medical school in Portland, as a medical doctor, a board-certified internist. But just to add that in there, the one and only Dr. McDougall, I keep telling the family, I'm the one and only Dr. McDougall. Take advantage of me, to get me to share as much as I can with you. There are lots of other people who have opinions on good diets and health and so on. And, I hear their opinions, not that I respect them. Some of them I do, but not very many. But anyway, I'm as some of our McDougall program employees have suggested, you ought to get somebody to do more of your work, like, more of your webinars and write your newsletters. And I said, I can't. I said, nobody has the knowledge and the point of views that I have. And so, once I'm not able to do the newsletters and the other things, I don't want anybody to take my place. I want them to leave my stuff alone.
Right. I understand you.
Leave my
stuff alone.
You can make comments on it. You can add what you want to it. But excuse me, I did it right the first time.
This is your life. Your life's a project. I mean, this is your life. You've built this.
Well, anyway, it gets a little personal on occasion.
It does get personal.
People suggest, well, maybe we should get somebody to help you and to do more for you.
Who do you have in mind?
Well, they actually have. There are some people out there, but excuse me, there's only one and only, as you said, Dr. McDougall.
That's
right or wrong, like me or don't like me, and don't expect somebody to come in and take my place. And if they try, just say, that's not Dr. McDougall. I know what he said. I've got it here in all his writings and books.
That's right.
And I saw him do it on the various lectures he gave, which are free on the internet.
Mm-hmm. Yeah. Yes.
Anyway, you got me off a personal.
All right. That's good.
Well, we're going to talk today about Alzheimer's disease, and the reason is this has been a topic of discussion from people from the high carbohydrate plant-based group of people that I deal with, and also from our uninformed, dangerous opponents that promote low-carb diets. They're all talking about Alzheimer's disease this day and giving their various hypotheses on what causes it and what you should do about it. And, from my viewpoint, they're all missing it, and it shouldn't be missed. I originally wrote about this in my June 2004 newsletter, which I think we may have mentioned last week, or hopefully somebody suggested you read it before today's discussion. It's June 2004, and it's called Alzheimer's Disease Can Be Safely Prevented and Treated Now. See, that's 2004. That would be 13 years ago. And I don't know. Some people have read it, I know, and some have gotten back to me. And I started out the newsletter by discussing the most famous Alzheimer's patient in the world, and that's Ronald Reagan. He died with Alzheimer's, complications of Alzheimer's. He died of old age and many other things. Had colon cancer, had lots of other problems related to the American diet. Nancy had breast cancer. So they were real Americans, let me say. But I started out with him just to kind of focus the attention on this disease. And then I discussed in here some of the causes, and there are, as I say, many discussions, people who are from the plant food based and the animal food based and no food based points of view. And you can find lots of opinions out there, but none as strong as the one that I presented in 2004 and that is still being presented today. And that is, and hear me clearly, ladies and gentlemen, aluminum, the metal aluminum poisoning causes Alzheimer's disease, period. Now, there are other factors like genetics, but there's only a small correlation in twin studies. So genetics isn't very much. And there may be other minerals involved, such as iron and copper. They've been suggested. Yeah, maybe at some level, maybe some variants. And the rich Western diet has been suggested. And that's a diet high in cholesterol, high in fat, the typical meat-laden, dairy-laden diet. And all those, I think, deserve some attention, some look over. But I think when you're done, I'm sure when you're done, if you do a thorough investigation, you'll come to the same conclusion I have, and that is aluminum poisoning is what it's all about. So I did an update of this article, this 2004 article. I did an update which is finished and hopefully will be published tomorrow on aluminum and Alzheimer's disease. And a few things have been added to the discussion. Back then, I remember, in fact, let me take you way back. When I wrote the book, The McDougall Program, 12 Days to Dynamic Health, my editor at Penguin Putnam, she told me that you cannot include this section on Alzheimer's disease in the book because it's just been disproven. It's not true that Alzheimer's is caused by aluminum. Now, that was probably sometime in the early 90s. And I had access to the internet. I was one of the early subscribers and had access to the National Library of Medicine. And so I went to the National Library of Medicine and I put in the search terms. And I encourage you to do this right today. The search terms at the National Library of Medicine, which is www.pubmed.gov. And I put in the search terms aluminum Alzheimer's disease, and about 700 articles came up, and I sent the link to my editor, and the material as I wrote it for the book, The McDougall Program, which is almost at least 20 years ago, was published as I wrote it because the evidence is clear. Now, if you search it, I just searched those terms and I found over 1,000 articles. And you can read them all. Almost all of them support the connection between aluminum poisoning and Alzheimer's disease. But you give it a read through. And when somebody like the Aluminum Association, which I talk about in the next newsletter, when somebody like the Aluminum Association says there's no evidence that aluminum causes Alzheimer's, you say, what about these 1,000 articles?
Well, what are they going to say? Yeah.
Well, what I would say is go look at the dairy industry and the meat industry. Right. They have their spin doctors too.
Right.
So anyway, the whole history of Alzheimer's development I went through in the newsletter comes out in 2 days. But in this one, I talk about a couple of possibilities. And it was inspired by a Time magazine article that must have been published sometime around June 2004 with a cover of Alzheimer's disease on the Time magazine. And then when you read the article, it mentioned nothing about aluminum, but it did mention the Western diet. So this is probably 14, 15 years ago, and mentioning the Western diet as being involved. And so I looked at it from that point of view and wrote about the Western diet being involved in the June 2004 newsletter. And some of the things I noted is that worldwide, the incidence of Alzheimer's parallels the incidence of heart disease and other diseases of rich foods. I wrote that population studies show high fat, high meat, high dairy diets have more Alzheimer's disease. People with atherosclerosis have a higher risk of Alzheimer's disease. And actually, there's a couple articles that show that taking statins, which lower cholesterol, is beneficial in terms of Alzheimer's disease. Of course, statins have been claimed to be beneficial for everything and should be put in the drinking water. They're so good for you. Anyway, and Alzheimer's disease is also described as a disease with plaques. One of the characteristic, we call them pathognomonic, which means you see the lesion, you identify the disease. And two pathognomonic lesions that you see on microscopic examination of the brain are neurofibular tangles, and also senile plaques are seen when you look there. Well, plaques, people who talk about plaques, they get their mind confused around plaques in the arteries and plaques in the brain and think they're the same. And, that's part of the confusion. Plaques just mean one thing to people, people who are not careful and really don't understand. Anyway, so there's some of the evidence that the Western diet causes Alzheimer's. And I think the Western diet is involved. This is aluminum poisoning. But aluminum, the metal, is found in the Earth's crust in complex forms, non-absorbable forms of aluminum, oxalates and other non-absorbable forms, silicates, non-absorbable forms. And they get into plants as non-absorbable compounds, non-absorbable. Like tea, for example, has very high levels of aluminum in it, but it's all complexed with another molecule, another element to produce a non-absorbable aluminum compound. And as a result, aluminum is naturally not part of our bodies and not part of the animal kingdom. It's supposed to be in the dirt, in the clay, in the mud, and it used to be until the late 1800s. We started finding ways to process aluminum into products, into forms that are absorbable, such as aluminum citrate, very absorbable. And by the way, when you buy your antacids in the store, there are aluminum citrate antacids. Don't buy them, because the citrate, or citrate of any form, increases the absorption of aluminum. So the Western diet may be involved in the sense that you have this aluminum in the environment. It should be non-absorbable, but industry has made it into absorbable compounds, and it gets into the body through the nose, the lungs, and the gastrointestinal tract. Well, the gastrointestinal tract forms a mucus, which actually prevents the absorption of aluminum. 99% of it prevents. So there are also other factors, like the ability to remove aluminum from the body, the permeability of the gut, the health of the gut, which would be influenced by a good diet. So I'm not trying to suggest, in fact, I'd like to suggest otherwise, that a good diet is important in preventing the aluminum getting into your body and staying in your body and accumulating into your body and eventually leading to Alzheimer's disease. So you want to consider the foundation of good health also in your efforts to avoid aluminum poisoning. Well, sources of aluminum poisoning, I'll just get into a couple of them. Eating and drinking waters, food additives are full of absorbable aluminum. Aerosol sprays that you spray in your armpits to stop the perspiration all contain aluminum compounds. It's the aluminum compounds that stop the sweat. So every morning people get up and they go, psst, and it goes right into their nose. That may be why some of the most severe cases of Alzheimer's have some of the greatest numbers of pathognomonic or lesions that are seen classic with Alzheimer's disease in the olfactory lobes of the brain and through the system that the olfactory lobes lead into in the brain. In those various areas of the brain that connect with the olfactory lobe of the brain, in those areas of the brain, you have the greatest evidence of the Alzheimer's disease. In other words, these lesions, neurofibrillar tangles, and senile plaques. Anyway, so you eat it, some is absorbed, you breathe it, is absorbed, and it is also absorbed through your skin. Those of you who are thinking that, well, I just use a roll-on aluminum containing, now the absorption isn't as much as breathing it, but it is absorbed through the skin. So anyway, the next section of this newsletter, June 2004, goes into the evidence that I presented at that time, which was, by the way, a good share of the evidence that is really important. It discusses the specific evidence on aluminum and Alzheimer's disease, and it goes into a whole bunch of ways that you should know that aluminum causes Alzheimer's. And we'll talk about those next week, some of that evidence, particularly two very important studies, one done in 1980, published in Science, showing that the central core of neurofibrillar tangles and senile plaques contain aluminum. You can see it under an electron microscope. That's pretty important. That was published in Science in 1980. We'll talk about that a little more next week after you have a chance to read the newsletter. And also, it was just reported in 2017. A study that shows a direct connection between the amount of aluminum in somebody's body and Alzheimer's disease. In other words, people with no aluminum or little aluminum in their body have almost no Alzheimer's disease. And as you move up in the onset as far as age and severity, you see more aluminum until you get to the extreme, which is what this article is published about, which we're going to talk about next week, is a familial Alzheimer's disease, which is early onset Alzheimer's, which may come as early as 30 years old. And I saw one reference as early as 15 years old. And is, of course, very progressive and deadly. These people have the highest aluminum content of any people studied. So this direct correlation between body content aluminum and Alzheimer's is a classic paper. Those are probably the two most important papers out of the more than 1,000 that you can read. Anyway, I give you lots of references in the 2004 newsletter and in the one that I'm going to publish that I've already written that'll be out in a day or two. And you can read over those and get some questions, and I think you'll be convinced that you should not be in personal contact with the most toxic, brain toxic metal on Earth, which is aluminum. And it happens to be the third most common element on Earth after oxygen and silicon. Yeah, and the ways you're going to prevent it is identifying aluminum in your environment and staying away from it. I'm going to also talk to you about some treatments for removing aluminum from the body in the next newsletter. And they're introduced in 2004. So anyway, I hope that stimulated your interest to the point where you'll read the June 2004 newsletter, and the one that comes out day after tomorrow, probably day after tomorrow. You'll take the time to read that. Challenge me. Tell me otherwise. Excuse me, if you're missing the aluminum connection, maybe you have Alzheimer's disease already.
That's
I don't know. I don't want to say anything nasty, but you just ain't working on all cylinders. That's what I know. Okay. Well, what do
Dr. McDougall, do you recommend that then we all be careful and read labels to make sure that whatever it is we buy does not have aluminum?
Aluminum should be identified on the label, but it's not in many cases. Alum, right. A-L-U-M is one word used. There are others used to hide or they just don't identify the aluminum. There's a list of high aluminum products in the 2004 newsletter. There are also aluminum cans that we use in pots and pans, and we'll offer some suggestions on what to do instead of that. Infant formulas.
Oh, I know.
Yes. Very high content of aluminum.
Especially doesn't toothpaste have it too as well?
Oh, yeah, toothpaste, even deodorants do.
Deodorants are famous for having it. I mean, it's just that we don't realize it, that it's everywhere, and you just have to be careful.
It's everywhere.
It's everywhere.
And, well,
so,
anyway.
But what you were saying, though, is that if the form is how can I say, if a plant has absorbed it from the ground, like tea leaves, let's say, then that's okay. Right. We're saying about
that's natural.
That's natural.
I mean, that's the way it is, and it absorbs and accumulates aluminum that is complexed with other elements that make it non-absorbable for the human gut.
Right.
And so they're safe, even though they'll say, tea leaves have, some of the highest content of aluminum around. Yeah, but, it's in a form that the gut can't absorb. So there's no association between Alzheimer's disease and tea drinking. When you eat the plants, they're still in the non-absorbable form. The aluminum compounds are, but industry takes and changes them into readily absorbable forms, or relatively more absorbable forms, so that people accumulate huge amounts of aluminum. The human body, or no animal, is supposed to contain aluminum. It's just it's a non-nutrient. It's a outside environmental chemical that's supposed to stay outside the body, but these days it doesn't. And the result is 44 million cases of Alzheimer's disease these days. And in 1926, I believe there were only 33 cases reported. And the first case was reported in 1901. And so Alzheimer's was virtually unknown until World War II. And during World War II, of course, we produced lots of things like nerve gases and all kinds of, industry really took off during World War II. And since then, it's come to the point where there are 44 million cases now worldwide in 2015. And they predict by 2040, there'll be 81 million cases if we see it 2040.
That's right. Yeah. Dr. McDougall, can someone do anything? Someone asked if to get rid of if we have accumulated aluminum.
Yes, you can. And I was going to save that for next week, but we'll see it. But that's okay. I'll give you a hint. I'll give you some discussion. In the 2004 newsletter is discussed desferoxamine, which is a chelating agent with a particular affinity for aluminum. And that was used it started in, in the 80s or in the early 90s. They started using it as an IM injection twice a day, 5 days a week. And they observed patients for 2 years and found that those who got the desferoxamine had a depletion of aluminum in their body and half the chance of progressing with Alzheimer's disease. But desferoxamine, you can buy it. If you look up the internet, you can buy it. It's an intramuscular injection. There's one company that sells it over the internet. Not that I'm recommending you do, but it is available. And you'd have to find some physician interested. You have to read more detail about the therapy, et cetera. And those links are in the 2004 newsletter and will again appear in the new newsletter. And then there's one other approach that, as far as I know, is safe. It's become popular in the press in the 2017s. It's a treatment invented by a researcher in England, the United Kingdom. And it is simple, and you can buy it over the counter. As far as I know, it's as safe as can be. And that's all I'm going to tell you until you get the newsletter. Okay,
that's very good.
You want to consider doing this other simple thing, and it's The evidence is that it removes aluminum from the body. It may slow the progression. There's tiny evidence that may slow the progression of Alzheimer's disease. It's safe, non-toxic, cheap, and in 2 days when you read the newsletter, you'll find out what it is. Oh,
we look forward to that. Dr. McDougall, so
but don't eat aluminum. Just get it out of your environment.
Just get it out. Yes. Well, it may not be easy for some people because we're surrounded by things. So we just have to start looking at everything we use in everyday life.
A starch-based diet, in other words, based around sweet potatoes, rice, corn. But the aluminum in the starch is complexed and is not absorbable.
Exactly.
If you cook in non-aluminum pots and pans, which we'll talk a little bit more about next week, you're not going to get aluminum. If you don't use aluminum-containing hygiene products, you just need to stay away from this stuff from now on. And you may consider the suggestion that I will present in the newsletter that comes out. I don't have a lot of experience with it, but anyway, cheap, safe, non-toxic, and makes sense. It fits into the mechanism of the cause of Alzheimer's disease, which is aluminum poisoning. I first talked about this. I just mentioned what I'm thinking about on the Ray Brim show. This was a big radio show like Larry King that was broadcast out of Los Angeles. In the 1980s, I talked about this on a show that was broadcast coast to coast, Ray Brim. And the response I got was a letter from the Alzheimer's Association, or some Alzheimer's industry spokesperson, and told me that this was all a bunch of baloney. Not the right term. We were trying to fix some easy term. Anyways, it was. They said what I said was untrue, and that I should stop saying it. And I think they were. If they thought they could do it, they were going to come after me legally, but they couldn't. And the same thing is happening today with this United Kingdom researcher that I talked about, who's heavily published. He must, I don't know, I guess have 50, 100 papers in the literature on all aluminum causing Alzheimer's. A really, really good work this man has done. He identified that he was confronted by the aluminum industry. Anybody that stands up against these industries used to be confronted. They've discovered, the dairy, the meat, the egg industry, that public confrontation is not in their best interest. No. Because it makes the topic available or of interest to the public. And so they just shut their mouths and stuff the cash in their pockets. Buyer beware. And that's just the way it is. And because we live in a free country with freedom of information, we have freedom from regulation. And so as a result, we're free, but we're also free to get poisoned by the food industries and hurt by other industries. There's a price to being free. And there's a value in some regulation. I'm sorry, folks.
Yeah. Well, many people here are having the question of what about the cans where food comes in and where drinks come in, beer cans or Coke cans? Or
Definitely, they all deliver aluminum that is absorbable in the body. And in the 2004 newsletter, I believe, is a actual article that looked at the different kinds of sodas, colas, different kinds of soft drinks in aluminum cans to see which absorbed more aluminum from the can material than the other. And so if you want to get real picky about this, you can figure out which of the cans, which of the contents of the cans is more aluminum releasing than the other, and you can drink this cola as opposed to. Just stay away from this stuff.
Just stay away.
Yeah. And these days they also health food cans. They use lining material. Now, what comes to mind is some kind of shellac, but so they use a lining material to protect the food product from the aluminum metal and lead that used to be used But aluminum, of course, is still used in cans, on all cans.
Right, right.
Yeah.
Well, I mean,
it's not that it's not a great metal and a great invention,
right.
but you don't want to eat it and breathe it.
It's not meant to be inside our bodies. Yeah. Well, but I mean, we do eat, a lot of us eat beans, and many other vegetables that come in cans.
Yeah.
So you have to be careful, I guess.
I wouldn't know what to tell you, except maybe the label says coated with shellac or coated with, coated with something to protect you. Now, bottles wouldn't have aluminum if you bought glass bottles. You need to be careful of these cans and pans and pots and utensils you use. They should not be made of aluminum. Again, as I talk to you, my 70-year-old brain, it sometimes remembers things that haven't come up in decades. But I remember, I must have been 7, 8 years old, maybe about that age. A pots and pans salesman came to our home,
right,
and tried to sell my mom and dad his new aluminum or new stainless steel pots and pans or whatever, non-aluminum material. And the demo that he did to an 8-year-old child is to have me watch the aluminum pans dissolve into the liquid that they were cooking.
Right.
And I'll never forget that. I mean, good grief. It was convincing. And I think my parents actually bought them, even though they were very low income people.
Mm-hmm.
They actually went and bought the non-aluminum pots and pans. Yeah.
Right.
It was a big deal.
It is. Wow. Well, I know that some people buy cans because of it's time. It's a time issue. I cook my own beans, but not everybody has the time. So sometimes it's a convenience, but we have to make sure that it's not going to cost.
And of course, when you go to eat out, I tell you how, Mary and I tell you how to eat out in Mexican and Chinese restaurants. If you add the extra criterion that they must be cooked in aluminum-free pots and pans, you're not going to be eating out.
Right.
But there are some obvious things that you can do once you understand the the brain toxicity of this metal. You can take some effort to stay away from it.
Yeah.
It's not a nutrient. There's no biologic need for it. It's never supposed to be in animals.
Right. So aluminum is a I had the word in my head mineral.
A metal.
Is that a mineral?
Yeah, they call it a mineral element. It's actually number 13 on the periodic table,
right?
Which would give it an atomic weight of 26, I think. But that takes many years. And, it's a metal, and as I say, it's third most common element on Earth after silicon and oxygen.
Right.
Unfortunately, it's all tied up in the Earth's crust.
Mm-hmm.
Or was, not now.
Not in our modern times. Well, Dr. McDougall, how about the odor that when we perspire under the arms? It does, because some people are asking, would the odor change according to what we're eating?
Yeah, and that's of course been a discussion of ours when we did the GI series and explained that. Sulfur-containing compounds are what stink, and high concentrations of sulfur-containing compounds are found in eggs and cheese and meat and fish, etc. So, you change your body odor, but body odor is normal. It's actually attractive. It's there for a reason. You're supposed to have body odor, and you're supposed to perspire. But remember, we talked about last week. We talked about vegetarians, herbivores, cool themselves by perspiring, whereas carnivores pant.
Right.
So you perspire, it smells. It smells for a reason, and that's to identify you as healthy and attractive to people close to you. But it stinks. You stink terrible when you eat foods that make you sick. But you're always going to sweat. You're supposed to sweat. You're
right.
supposed to anyway. Yeah.
Yeah.
Oh, anyway, how do you cover up and make yourself smell better? I'll tell you, in my personal life, I buy deodorants and I read the ingredients, roll-on type of deodorants, and read the ingredients to make sure that they don't contain an antiperspirant, which is aluminum chloride or aluminum carbonate, I think, but it's aluminum chloride. Aluminum chloride has to be present to stop the sweat glands. So, I read the label. A lot of people get fooled when they go to natural food exhibits and they walk down the aisle and people are selling alum rocks. Don't use deodorants, but take this rock, which is called alum, and rub it on your armpits, and it'll stop the perspiration. But what is alum? What is an alum rock? It's aluminum.
Right.
Anyway, so you could use a cover-up odor found in a deodorant that has a reasonable amount of ingredients, and eat good and hang around people who eat good, and wash once in a while. Not too often, but once in a while.
People that smell the same way, plant-based people, we all smell the same.
Quite. This is true, and we talked about this in the past. You stink like what you eat, and you know this from garlic and onions, but unfortunately, those sulfur compounds are non-toxic, as opposed to sulfur compounds that are found in animal foods, which are very toxic, encouraging cancer growth, bowel disease. It's linked with all kinds of issues. So, yeah, you do smell like what you eat.
Yeah.
And you want to smell like a dead animal. I mean, where do you think that those compounds that you eat go? Anyway.
They have to go somewhere. Now, the body naturally cannot get rid of aluminum, and other than using what you're going to share with us next week.
No, it does. First of all, the body, the intestinal tract particularly, has a mucous membrane, which is anti-aluminum in terms of absorption. And the kidneys do eliminate aluminum from the kidneys into the urine. It does it naturally, but you can accelerate that elimination with chelating substances such as desferoxamine, which I think you should only consider under medical supervision with somebody who knows what they're doing and is willing to learn about desferoxamine. And there are other things that you can do to accelerate aluminum absorption, accelerate aluminum removal in the body, and of course the one on keeping a secret. So
yes.
Yeah, you can accelerate the riddance of aluminum from the body, and you can measure that as a lower aluminum content in the tissues, and also probably as a reduction in the clinical progression of Alzheimer's. And I say probably because the evidence is quite meager. Why is the evidence meager? Well, who in the heck's going to study a non-patented compound desferoxamine or a non-patentable simple thing I'm going to talk about in the newsletter?
Right.
Who's going to publicize that? Well, they're going to publicize when industry develops a pill, a safe pill, like statins, like cholesterol-lowering statins. You didn't know about cholesterol before statins came on the market 20-some years ago.
Right.
And then everybody learned about statins. And everybody learns about I turn on the TV now, Gustavo, and almost every commercial is advertising diabetes medications, which are toxic and useless. Read my January 2017 newsletter. But everybody knows about diabetes.
Oh, yes.
Because the industry says so. You got to create the consumer population, just like with GERD. Prilosec came on the market. You learned about GERD. Why? Because they needed to awaken the market. So when a pill comes on the market that is patentable prescribable.
They were going to hear about it.
Probably will cost you $300-400 a month. That's usually the consumer's going rate. That's all the consumer will bear, is about $400 a month with insurance paying for it. On that drug, and they're developing these drugs, by the way. So I'm not talking about a dream or hypothesis. This is ongoing development of oral chelating medications that remove toxic metals, even iron, which is a necessary nutrient, and aluminum and other toxic metals from the body. If they had a pill that worked like this desferoxamine does as an intramuscular injection, that they could sell for $300-400 a month, believe me, everybody would know about Alzheimer's disease and aluminum.
Right.
It would be anyway.
Yeah.
You understand what it's about. It's called big business.
It's big business.
Nobody's trying to hurt you. It's not a conspiracy. It's just money.
Yeah. Yeah. Well, Dr. McDougall, what about, have you ever, in your experience, have you ever seen any type of Alzheimer's being reversed or once?
Well, I personally haven't. In the papers reported on desferoxamine and this other simple, you keep making me go back to that, other simple way of removing for the body, which is going to be a newsletter in 48 hours. Those studies show a slowing of progression of the disease. Again, this is minor data.
Right.
It's not the data that should be there, the studies that should be done.
Yeah.
Because of financial interests. So as far as slowing or stopping the progression or reversing, I don't think it'll be reversed. I'm pretty sure you can't reverse what has already been lost, because this is scar tissue. These pathognomonic lesions, these neurofibrillar tangles and senile plaques are end-stage disease. I mean, this is not going to, it's like a scar. It's not going to come back. That brain tissue is gone forever. So you just want to not lose any more brain. Right. That's all you got.
That's all you got.
Yeah. I'm hoping this will last another 20 years, but and I'm going to take good care of it, and I'm not going to poison it with aluminum.
No. And especially, like some people are writing in the chat here, aluminum foil. We don't want it to heat it. We don't want to touch the food, right? Am I correct? Or
the way Mary cooks with aluminum foil, because there are some things that just don't work out well in cooking with aluminum foil, like potatoes and onions on a pan. You put an aluminum sealant, foil sealant around it. So she put something called parchment paper, which you can buy in any grocery store, in between the food and the aluminum foil. It's just like we cook with aluminum pots and pans, but they are coated with a relatively safe coating that keeps the food from the aluminum. We'll talk about that next week.
Right. Okay.
When I say relatively safe, people could argue otherwise. Cooking glass or ceramic or, stainless steel or, whatever you think is safe. I'm sure you shouldn't be cooking in aluminum.
Yes. All right. Okay. Well, this has been most enlightening. People love it. And this is life-saving information. Thank you, Dr. McDougall.
Well, it should be on the tip of everybody's tongue. It won't be. Share it with your friends and family, just like the advisability of a starch-based diet. And every day I get an email from somebody who says, how about this new diet by Dr. So-and-so? Or I just watched Dr. Oz, and there's an expert who contradicts
there's always an expert.
I get these. And then what people do in their emails is they ask me to justify my viewpoint over so-and-so low carb or low lectin or low whatever, high good fat, etc. person. They expect me to personally write them a letter justifying my position over theirs. Excuse me, I've written 13 national best-selling books. I've written over 130 newsletter articles. I've done 50 webinars. I've provided tens of thousands of scientific references. And plus, if you just open your eyes, it is obvious that what I'm saying is true. So You can ask all you want. You pick your guru. There are lots out there to pick. You want to pick one that recommends, as today's newspaper did, our Press Democrat, recommends beef wrapped in bacon, then do it. It's your choice. I've done my job. I've told you what I believe to be the truth with 50 years of experience in medicine.
Yes.
You find somebody else you want to believe. I bet you can find somebody that will recommend my favorite almost killed me food, pepperoni pizza, as a way to solve all problems. I want to hear that guru. Pepperoni pizza. Come on, bring him on.
We do want to hear.
I was 70 pounds overweight. I almost died. But that pepperoni pizza I want to hear it's good for me.
Yeah. We like you said before, we all want to hear good news about our bad habits. So,
the truth is there again. PubMed.gov is the website you can go to, and our aluminum and Alzheimer's. You'll find over 1,000 articles. Read them between now and next week, and you tell me. And there'll be some from the spin doctors from the aluminum industry. Oh, believe me.
Oh, yeah.
You'll find them, and you'll find other people who have their points of view. They'll say such and such is just a flaw, etc. Well, fine. I believe, and I've been researching this for 30 years. I've kept up with the scientific data. I believe the foundation is aluminum poisoning, and it doesn't exclude taking good care of yourself with a starch-based diet.
It doesn't.
Anyway.
Well, everyone can submit questions for next week. While Dr. McDougall was talking, you had a question that we didn't answer, send it to webinar@drmcdougall.com, and someone will collect the questions and pass it on to us.
And if you don't get the newsletter, or this video is being passed on to friends and relatives, and you want to get the newsletter, it's free, no gimmicks. It's from my website. www.drmcdougall.com. The only thing that's advertised from us are McDougall things.
Right.
We don't advertise non-stick aluminum pots and pans or this special treatment I'm going to be talking about.
Or deodorant.
We don't advertise anything.
McDougall deodorant. Okay.
People are going to look back and they're going to see, because I've seen people sell out very honest folks, like, for example, Nathan Pritikin.
Yes.
The things that are recommended by the Pritikin program since he died would make Nathan roll over in his grave. And he was a kind man. And so, anyway, I don't know where we're going.
Let's not talk about it.
Let's not.
Well, Dr. McDougall, your message hasn't changed for 50 years. You provide us with research and studies and your books, and you're consistent, and you tell the truth.
And the thing I want to add, which is heartening to me, a lot of people say, how can you take this abuse? People saying all these things behind your back. Excuse me, I can find in modern day media more and more people discovering my point of view, which is an old point of view. It goes back thousands of years. But more and more people, and they publish it in the press, but of course, media has more money, big business has more money, so they get relevant associated or media to take and print their side of the story, which keeps their business running.
All right,
Gustavo, I just can't thank you enough for how much you helped us.
Thank you. We're all appreciative. Thank you, Dr. McDougall. And we look forward to that wonderful newsletter. Pass it on, everybody, to your family and friends. And
you can sign up for it at drmcdougall.com. That's where I was going, probably.
Exactly. And tell them about the webinar next week. We should have thousands of people logging in. This is very important that we know this information.
I hope so. And thank you, folks. And of course, the webinars are downloaded to my website, free. You can link them, send them, etc. No gimmicks. And we always offer challenges too. You may think that these emails that are sent to webinar@drmcdougall.com, we just throw out the ones that don't favor our point of view. Well, that's not true. We're very welcoming to points of view that are different than ours. But they need to at least be people with, some credibility. Oh, I get a lot of newsletters from, or a lot of emails from people that really have little basis for what they believe.
Yeah.
But we're happy to entertain other points of view. So don't think we're not. If you ever find us with that kind of prejudice, please bring it to our attention.
Yes. All right. Very good. We should have the link up for the registration for that webinar in a couple of days. Okay. So everybody remember to go to drmcdougall.com, because there's where you get to watch the old, the past webinars, and you can sign up for the new ones.
And the newsletters are all published there.
And the newsletters are there. Yes, that's right.
And it's all free. And it's no gimmicks.
Right. Well, thank you again, Dr.
That's a pleasure.
I hope you have a great weekend. Goodbye, everyone, and we'll see you next week.
Bye-bye.
Okay, bye-bye.